everyone. So today I will be talking about a very familiar topic, family planning. Yes, we'll be talking about contraceptives. However, even though many of us are familiar, we still need more information on a daily basis with regards to the different methods, how they are used, and when can you start or initiate your methods. First, I encourage you, based on the relationship that you have with your partner, you want to sit down, you want to determine how many children, you want to determine the spacing amongst the children, you want to determine if you want any children any at all, and that will help you to make a decision on the right method to begin. You want to have a proper discussion with your midwife, your pharmacist, or your gynecologist with regards to the different methods, their side effects, their mode of action, and if you have any medical condition. For example, if you're hypertensive, you want to avoid your combined oral contraceptive pills. Those are your pills with both estrogen and progesterone only, for example. All right, so you want to make sure that you have the information before you make a concise decision as to, yes, this is the method that I'm going to choose. All right, so let us have a discussion today. We'll be talking about all the possible methods that we do offer here in Jamaica and with extension the world, and let us see how it goes. Alright, so continuing on contraceptives, we want to talk about the emergency contraceptive, also known as your morning after pill. Now, once you have had unprotected sex, no intention of becoming pregnant or wanting a child at this time, you must take your emergency contraceptive or your morning after pill within 72 hours, approximately 3 days, up to 120 hours, approximately 5 days. However, it is better that you take it within the 72 hours after having unprotected sex. Alright, so please think wisely. Once you've had unprotected sex and there's no intention of wanting a child at this time, it is very important that you take your emergency contraceptives within 72 hours of having unprotected sex, up to 120 hours, which is equivalent to 3 to 5 days. Alright, please. So we're moving on to our oral contraceptive pills, and a word of caution. If you know you are not going to remember to take a pill every day, do not start it. Alright? Do not even think about it. Choose another method, please. First, you need to remember to take a pill every day. There should be no break day. Every day there is, you should be taking a pill. Alright, so we have two types of oral contraceptives. We have the combined, this is consisting of estrogen and progesterone, and we have the progesterone only contraceptive pills. This one that I have here, this is our combined oral contraceptive pill, as I said before, with our estrogen and our progesterone. Please try to take a pill every day at the same time for better results. Alright, first you want to follow the arrow. So you start and you want to take a pill every day, one pill every day, and you follow the arrow in a snake-like pattern. When you get to these red pills, these are not contraceptives, these are iron tablets. Around the third or the fourth pill, the period should come. Alright? Then you continue with a pill every day. As I said, whether it's a contraceptive or your iron tablets, there shouldn't be a day that you go without a pill. Once the last red pill is finished, you want to continue with another pack and you start right here again. Alright, there's no break day with this pill. Now you have to remember to take a pill every day, and I am consistently talking about this. You must remember to take a pill every day at the same time for better results. So if you're going to take it in the morning, it must be in the morning at all times. If you're going to take it in the evening, it must be in the evening at all times. Choose a time, set your alarm, and you stick to it for better results. Now, if you miss a pill, not to worry. You take the pill that you have forgotten as soon as you remember, and you continue with the other pills. Alright? Now, if you know you have missed a few days out of your pills, you use a condom. Do not take any chances. Now, there are some pills that you will have a period on, and those are the combined oral contraceptives, as I said before, your period will come consistently every month. You have the progesterone only, that you might no longer have a period eventually, or you might have spotting in between periods. Now, please make your wise choices for the combined oral contraceptive tablets for hypertensive clients. Please, this is the one you want to stay away from. All right? So if you're hypertensive, do not consider this combined oral contraceptive method. The risk of seizure, for a stroke or seizure, is there. For those who are 35 and over and you're a smoker, the risk of a stroke is there, and such the like. Please stay away from the combined oral contraceptive if you have been diagnosed with certain conditions. All right? Thank you. Alright, so continuing on our family planning today that we're talking about, I'll be talking about the injectables. Now, there are two types. You have the combined injectables, which is our estrogen and our progesterone only, and then we have our progesterone only. The estrogen and progesterone combined injectable is known as the Mesigina. This one you get once every month, you get an injection. Now, the next one that we talk about is our Depo-Provera, which is progesterone only. And it is this one here that you get an injection every 3 months. So there's a difference. You get an injection every month with the Mesigina, and you get an injection every 3 months with the Depo-Provera. All right? The monthly one, you will have a period. The 3 monthly, you might not have a period eventually because it's preventing ovulation. All right, it's thickening the cervical mucus, and it is also thinning the lining of the uterus, also known as the endometrium, which makes it implantation a little bit more difficult. All right, so please remember, you have the monthly injection, the Mesigina, and you have the every 3 month injection, the Depo-Provera. All right, this one you might eventually not have a period. So please, if you're having side effects, some persons have reported bleeding in between periods. If you're bleeding for more than 10 days, please return to your healthcare provider for them to assist you. Do not be home and bleeding and get nothing done about it. You can easily become anemic on this method. All right? You want to take charge of your health, and so we ask that whatever challenge that you're having, please reach out to your healthcare provider for assistance. All right. Next, we're going to be talking about our intrauterine contraceptive device, also known as our copper T specifically. Now, this device, it is placed in the womb, in the uterus, and if left undisturbed, it is valid for up to 12 years. All right. So if you want to have another child in the next 5 years, you return to your midwife, and the midwife or your doctor will remove the copper T. You go and you have your baby, and you can return to put it if so desired. All right, so this is a speculum. Yes, this is a speculum. It is placed in the vagina. It is opened like this to view the cervix. All right. Now, the procedure is done where this is the copper T. All right, and it is a T-shape. This is an actual copper T that is placed inside the womb. It is a T-shaped device as it speaks, and at the ends it has copper at the ends. Now, the sperms are allergic to copper. All right, so when the sperms go there, the copper and them have a fight, and the copper always wins. Most times it does win. It's just a small percentage of failure rate. All right. Yes, this little thing with copper at the ends is enough to prevent pregnancy for up to 12 years. All right. The string, there's a little string that is left, cut to about here. A little string is left for you to check every month after your period to ensure that the copper T is still in place. All right. Remember, as with any other foreign object to your body, you want to give this method at least 6 months to a year for your body to get used to it. So some persons tend to say that they're experiencing side effects, they're having pains, heavier periods. You want to give the method some time for your body to actually get used to it before you can say definitely that yes, this method is not working out for me. All right, so please contact, get all the information that you need. This little thing can prevent pregnancy for up to 12 years. Yes. All right. All right, so today I'll be talking about the implants. All right, so in older times, there were the Norplants, which they had 6 thin flexible capsules that were placed using an incision by a doctor underneath the skin, and this was progesterone only. All right, now they have revised it, now known as the Jadel. Yes, the Jadel, and this is now limited to 2 flexible capsules that a little incision, minor surgery is done, placed underneath the skin, and it releases progesterone only to prevent pregnancy for up to 5 years. All right, so you want to think about that one also. Okay, so continuing on our talk about family planning, we're going to be talking about condoms. Yes, condoms, the good old condoms. So we have our female condoms, also known as our femidom. Yes, and please, I do not want to see anybody using their teeth to rip a condom. We have our perforated edges here, and we have our perforated edges here. Remember, the condoms are the only method that protects you from sexually transmitted infections apart from abstinence. So whatever other method that you choose, you want to put a condom with it. All right, so we have the female condoms, and we also have our male condoms that we are also familiar with. All right, so for the female condoms, you want to tear it along the perforated edges. So you tear it in a straight line going down. All right, you remove your condom. Yes. All right, so we have 2 parts. We have 2 edges. All right, we have an enclosed edge, and we have the opening. This part, you want to do it like this, and you put it into the vagina. Now put it inside. This part is going to remain opened onto the labia on the outside, and this is where the penis will enter inside here. All right, when you're through and the gentleman has removed his member, you want to twist. So you're gonna twist it like this so no spillage takes place, and you gently remove it from the vagina and you discard of it. All right, yes, so this is the female condom, remember. Next we have our male condom. All right, and the same goes for our male condom. We do not want to be ripping anything with our teeth. All right, we want to go down the perforated edges, and we remove our condom carefully. All right, we have it right here, and let's get our penis. All right, so we have our penis right here. We're putting our penis down. All right, you want to inspect. So you want to carefully inspect the condom. Then you're going to put it on the erect penis. You're going to leave a little space up top, and then you're going to gently roll your penis. Roll your condom down. All right, roll it all the way down to the shaft. All right, and this is what an actual condom put on the proper way looks like. So you want to have a little bit remaining at the tip to collect the ejaculate. All right, and you roll it all the way down to the. Once the sexual act has been removed, you carefully remove the condom from the penis, right? And you want to remove it in a way that there is no spillage. All right, you take your time and you remove the condom. Once you've gotten the condom off, all right, you want to hold the edges right here, and you're either gonna do it like this or you can tie. All right, this way too you want to inspect. So you're inspecting the semen that has been ejaculated, and you're checking for any blood streaks, anything abnormal. All right, and you discard of it. All right, please do not flush it. do not flush in the toilet, you discard of it. All right, and that's all about our condoms. Remember, it is the only method that prevents you from sexually transmitted infection, so please use it wisely and accurately. Another method that I want to talk about is our lactated amenorrhea, and this is for those mothers who are exclusively breastfeeding their babies, that is breast milk only for the first 6 months of life. Bear in mind that if your period has returned before that 6 month period, it is no longer safe for you to try this method. If your baby is over 6 months old, it is no longer safe for you to try this method. All right, so it must be for those mothers who are strictly breastfeeding their babies only for the first 6 months of life. All right, we must make mention of our vasectomy. This is a permanent method for the male where the vas deferens is cut to prevent sperms from being in the semen. However, up to 3 months after surgery, the gentleman must wear a condom because small amounts of sperms can be in the semen, which could be enough to impregnate a woman. There's also tubal ligation. This is where the fallopian tube in the woman has been cut to prevent the fusion or the meeting of the egg and the sperm. All right, so please take notes. Okay, so in closing, remember these are just a few of the many methods that are there on the market, but these are some of the most popular ones that has been chosen. All right, please remember to consult your physician or your healthcare provider, read the choices, the side effects. With regards to the side effects, as with anything that is foreign to your body, you want to give your body some time to adjust before you can definitely say that this method is definitely not for me. All right, and hence why I say you need to be assessed. All right, so let's go back. We have our female condoms, we have our male condoms, we have our 3-month injections, we also have our 1-month injectables, we have our copper T, which are one of the many intrauterine contraceptive devices which last for up to 12 years. All right, we have our oral contraceptive pills. Remember, we have combined and we also have progesterone only. All right, so please feel free to reach out to me with regards to any method that I've spoken about and others that you've been thinking about. I am ready and waiting to answer any questions that you might have at this time or in the near future. All right, please be safe, choose wisely, and let us all be happy. Thank you for choosing Midwife par excellence. See you soon.